It's Tuesday and we are coming live from Tenri Group of Hospitals Majimbo. Just like we told you, we shall be coming here every week to educate you more about your health. And today we are talking about our children and our mothers, because children and mothers are very important today. Today we are talking about respiratory distress syndrome. That is a very hard topic, especially to me, a person who is not a medic. But we have Mora here, who is our RCO Pediatrics here at Tenri Group of Hospitals, who will be telling us more about respiratory distress syndrome, because here at Tenri we have a NICU session whereby we take care of babies who have problems with their bone. We also have, take care of children who have jaundice and what have you. So Dr. will be explaining all these things to you and how to prevent, what are the causes of a child having this respiratory distress syndrome, so that you can understand more about your child's health. So karibuni sana and karibu daktari to the show.
Thank you so much.
You can introduce yourself to the viewers so they can know you more.
Good afternoon, dear viewers. My name is Rose Mura, RCO Pediatrics in Children's Hospital. Welcome once again.
Okay, so today, Doctor, we talk about respiratory distress syndrome, and you can tell us more about it. What is this disease?
Yeah, respiratory distress syndrome is a condition that it is more common in children born less than 37 weeks, and it normally presents with respiratory distress. This is due to immaturity of the lungs. Yeah. So any baby born less than 37 weeks has immature lungs? Of course, because lung maturity is normally the lungs develop in the third trimester. So if a child is born less than 37 weeks of age, he's at risk of getting this syndrome because of the immaturity of the lungs. Yeah. Okay, so initially, what are maybe some of the signs and symptoms of a child that has this respiratory problem? Yeah, the common symptoms of respiratory distress syndrome is either a child is born immediately and you notice that this child has respiratory distress. That is fast breathing, the child is grunting, can also present with bluish coloration of the peripheries or even the mucous membranes. That is, you can also notice generalized the baby is born blue. This is a sign that this baby needs oxygen, and because the lungs are so immature, they've not expanded enough so that when the baby breathes in, is able to, the oxygen supply in the body is going to be well enough. So there is normally fast breathing. This child can also be having a grunting, or even the oxygen levels, when you try to measure with the pulse oximeter, they are too low. Okay, is there a possibility a baby who is born normally, the mother was due to get the baby, is there a possibility for that child to have that problem? A child born at term or born at preterm? Born at term. At times you can also have, especially if a child is born and also there is maybe meconium on the wall, the baby has aspirated liquor, also can present with difficult breathing. So what happens when maybe a child is born on term and maybe they have this problem? So what do you do to treat this baby? Oh, these are conditions that we are able to manage. For one, we take this baby, we are able to support their respiratory system through oxygenation. We fix the oxygen either via nasal prongs or via on the rebreather masks, or even initiate on CPAP if there is a need be. Okay, nice one. So there's NBU and then there's NICU. So which one treats the babies with the nini? For NICU, we say it's our neonatal intensive care unit. These are a place where we normally admit babies, especially who are born preterm and they have severe respiratory distress, and they need critical care management. And these are services that we do offer. So I can see machines just right here with us. Maybe you can explain us the treatment of respiratory distress, and as that now we can understand it more. Maybe you can come here so that the viewers are able to see better of what you're explaining to us. So for the treatment of respiratory distress syndrome, it also depends on the gestation of these babies. We normally initiate children on CPAP if they're within the age of 28 weeks and more than 28 to 30 weeks, and they have a weight of more than 1 kg. So we normally have this machine that it's called a CPAP machine, that is called the continuous positive airway pressure. This is a machine that is going to help these babies because they are not able to, because of the continuous oxygenation that they always need. So this machine is going to help them to recovery. Yeah.
So that is the machine now they use.
This is the machine.
What about there's something else out there?
So this is a machine for monitoring. Especially it's now going to monitor your respirations, especially when we've fixed the baby on the machine. We do monitoring. We do monitoring of the vitals, especially the temperature, the respiratory rates, the pulse oximeter. We also monitor their temperatures as well. We also have our nurses who are well trained on use of these machines. So once we prescribe the use of these machines, we are going to do monitoring, especially to see if this baby is going to improve or there is need for more management.
Okay.
Yeah.
So for how long do you do the management of the baby using the machine?
These babies who are especially put on this machine, there is always monitoring. A reason as to why you do not stop this CPAP machine, especially if the baby has not improved, especially on the respiratory distress. So there are some parameters that we normally look at so that we are able to identify if this baby is now going to be out of this machine. For one, the saturation levels must be above 90%. That is the oxygen levels. Then the child must be clinically comfortable. There is no signs of grunting. The respiratory rate has stabilized. That is within 60 breaths per minute. Then the vitals are stable, and then we are now going to stop the use of this machine.
So it continues until the baby maybe is 40 weeks, or what happens?
Not at 40 weeks. As much as this baby is still a preterm and still has signs of respiratory distress, we are not going to wean off the use of these machines. Once the respiratory rates and the oxygen saturations are okay, the doctor will always do the monitoring together with the nurses who have been writing down the saturation levels, the respiratory system. Once you've noted that all is within normal range, then we are going to wean off. But remember, not all babies are going to use this machine. Especially there are those babies either who normally present with persistent convulsions, or either they are gasping or they have apnea attacks. We are not going to initiate this machine because that is a child who will either complicate, because you can't fix a child who is already convulsing on this machine. You either control the convulsions first. Once you control the convulsions, then we initiate on the CPAP.
So I can see another machine on this other side. So maybe you can tell us which baby is put on these machines so that people can understand way better.
Great. This is our incubator. We have one here in our NICU, and there are also machines on the other side on the NBU unit, where we have a phototherapy machines. We also have other incubator with the other machines that will help your babies respond well. This is a child who also born preterm, but they have no signs of distress. Preterms, not all babies who are born preterm have respiratory distress. So we normally use this machine to always keep the babies warm. And once you've initiated on the incubator, or once you put the baby on the incubator, we also encourage the mother, because not all times that the baby is going to stay in this machine. We also encourage the mothers to do what we call a kangaroo mother care.
Can kangaroo mother care be done by the father? Maybe?
Yes, of course.
So the kangaroo mother care is done here at the hospital or at home?
We encourage it's done in hospital and even at home.
So any other baby that can have any other condition that can maybe be put in an incubator or in the ICU, any other condition that can make a child have be put in those machines?
We have either children brought in either through conditions like aspiration. We have conditions either a mother is feeding a baby at home and mistakenly the child inhales the vomiters. So these are child who needs critical care. So we admit them here and do monitoring from this end.
So that means the NBU unit And the NICU unit here at Tenri is very well equipped, and you guys are taking care of our children.
Yes, we do.
So now, because I understand people are getting the Nini and they are writing to us some messages. Some people are saying, yeah, great show, great information, doc. I think you can talk to parents who are at home, or mothers who are maybe about to get a child, or a mother is maybe worried they may get a baby who is maybe has not reached to term. So you can talk to them and maybe encourage them that it is possible for them to have a preterm baby, and the baby grows and becomes big.
Thank you once again. So at Embu Children's Hospital, there's a facility that we offer NBU services, and we also offer NICU services. So we always encourage through our gyne and obstetric clinics that we do follow-ups, especially for mothers with risk facilities. Risk factors, especially like high blood pressure or even diabetes. These are conditions that may make a mother deliver preterm babies. But once by bad luck you deliver a preterm in our facility, we are able to handle these babies. We have a facility, and we have qualified doctors that are going to monitor the well-being of your baby, and we expect the good outcome of these infants. So welcome once again. In case you need these services, we are here for you.
Thank you so much, Doc, for the show. Thank you for showing up in your busy schedule. We understand that. So thank you for the great information. I'm sure the viewers will continue asking more questions, and I'll keep directing them to you so that you can answer them. And I can see someone else here by the name Brenda is watching, saying a very great show. Someone else here by the name Samuel Shua is also watching, and so many people are watching, and sometimes they write messages even on our inbox that they can ask questions. And a quick one is that here at Tenri, our inner branch and our town branch, you can get maternity services. Either it's CS or normal delivery using your NHIF card, so you don't have to be worried at home. You can get these services using your NHIF card without adding a coin. At Tenri Ena and also Tenri Doctors Plaza. We appreciate you for watching. You can keep writing to us all the questions, and direct the question to Dr. You can also talk to us on all our social media pages. You can also talk to us on 0723 386 706. You can call that number for any inquiry that you have. You can also call us on 0718 918 189. So thank you so much for watching. Until next time.